So we know that parent-child relationships are influential in human development. The sorts of interactions parents and kids are having in the early years go on to inform competence and growth in other areas such as language, social functioning, emotional stability, and success with peers. So that being said, the reality is that a lot of parents are challenged with the task of parenting across multiple kids at any given time. A lot of children are growing up alongside brothers and sisters. So that leads us to ask the question, is the difference or the discrepancy between what I get and what my sibling gets, is that also contributing to my growth as an individual? So that's why we decided to study favoritism. We know that parents aren't intentionally favoring one child over the other in the vast majority of situations. The reality is that siblings are different from one another, and they bring different things to the table. One child might be a little more active and gregarious. Another child might have a bit more of a difficult temperament and be fussier. So in that sense, we can see that children might draw upon a degree of favoritism within the family. On top of that, we know that parenting is one of the most difficult jobs in the world, and parents are stressed. So given the very difficult task of raising multiple developing humans at any given time, it's not inconceivable that we're going to be allocating a little more resources to one child, or a little more harshness and short temper to another. So there have been a number of studies that have demonstrated favoritism can lead to a variety of social or emotional or behavioral problems in kids, where a sibling who is disfavored will be more likely to have some disruptive behavior, or maybe more difficulty with peers, or maybe a little bit more emotional. However, I guess more than ever these days, psychologists are connecting these psychological states with biological stress responses, so that feeling we get when things get really difficult. So that led us to the question, can favoritism have an impact on general health over and above these psychological outcomes that we've already had a look at? So we recently published a study in Social Science and Medicine where we looked at this question among 501 Canadian families. We recruited these families within 7 days of a child being born, and one stipulation for participating in the study was that every family, there must be a newborn and an older sibling in order to get at that favoritism within families or across siblings. So we recruited them into the study and measured parenting at 18 months, where we had mothers fill out standardized scales about how much harshness or hostility or disciplinary action has to be taken towards sibling A and sibling B, the younger and the older child. Also at that time we had parents fill out a general measure about their child's medical health. So that was at 18 months, and then again when the youngest child is about 3 years old, we measure health again. So we have these repeated measures of health at 18 months and at 3 years, and that repeated measurement allows us to see, is there a change in health? And given that we measured parenting previously to this measure of change, we can ask, is there a direction of effects? Does parenting predict, does favoritism specifically predict a change in health? So as we hypothesized, it did. It turned out that siblings who are disfavored had a greater odds of having a decline in health over that period of time. About 50% greater odds of having a decline in health. However, a pretty interesting finding emerged. We realized that disadvantage of being disfavored, that discrepancy in the health outcomes of children, was only evident in homes that were of lower socioeconomic status. So we know that health risks don't occur in isolation. A little bit of challenge in somebody's life is typically not enough to make a measurable impact on health and functioning. However, when a lot of challenges combine, we start to see an influence of this. So for example, when things are tight, when things are a little more stressful around the house, other factors in our lives, such as our relationships with others, might carry a little more weight. So in homes where there is, challenge and stress, we see that this effect of being disfavored is more impactful. So we know that parenting is important. We know that the parenting that is happening relative to a sibling or favoritism is important for psychological growth. Our study suggests that this is also true for health. However, in order to understand the sorts of things that are informing the health of children, we need to be considering the interpersonal processes that are happening within a home, such as parent-child interactions, in addition to broader social determinants of health, including income and education.